website and on YouTube for viewing after the webinar. Thank you so much.
Thank you. The introduction was provided here by Zara, who's the Executive Assistant here at the BC Support Unit. And in the room, we have the Patient Engagement Methods Cluster Lead, Dr. Erin Michalak. And beside me is Dr. Sterling Bryan, who is the Scientific Director for the Methods Clusters at the Support Unit, and Larry Morose, who's the Research Navigation Lead for Vancouver Centre. I see that we have about, sorry, did you say about 12 to 15 people who are joining us at this point. Thank you very much, as Sarah said, for that. We're going to jump right into it. I'm going to pass over to Erin to lead us through the first slides here. For you. Thank you.
Okay, so we were talking about two things. We were talking about cherry trees and dogs, kind of common themes here. And to set the scene from where we're joining you today on Broadway, we can see a row of cherry trees that are just drenched with blossoms right now. So I hope you two have a window and can see a little bit of beautiful BC from where you're joining us today. Even better if you have a puppy at your feet. That's an ideal combo. We are actually trying to do something a little bit more grandiose than is described in this particular slide for the purpose of this webinar today. It states that we were going to be sharing the highlights of what was discussed at the visioning workshop, which we held on February 20th. Actually, what we're going to try and do is give you an overview of pretty much all of the work to date in this particular cluster of the last 6 or 7 months. And we will get through that as efficiently as possible and try and leave as much time as possible at the end for questions, which I'm sure you'll have ready to pose for us all. So to set the table for where we're at and what we've completed within the Patient Engagement Methods cluster to date, this is my point to pass over to you, Alison. I was about to take all of your slides.
Oh,
so enthusiastic about it.
So we had 3 objectives for the Patient Engagement Visioning Workshop. And the first one was to inform the development of a collective vision for the cluster. So that was to bring together a diverse group of stakeholders from all over BC who would collectively inform a collaborative framework that would be the basis of a work plan that will be developed for the methods cluster. And then, because we were all together, to stimulate the development of a community of methodologists, the researchers, as well as other stakeholders, in particular our patient partners, decision maker partners, and healthcare provider partners, who would all contribute to the activities of the cluster. So just so that we're all on the same page, just want to go over a quick definition of how the BC Support Unit defines patient-oriented research. It is a continuum of research that engages patients as partners, focuses on patient-identified priorities, is conducted by multidisciplinary teams in partnership with stakeholders, and aims to apply the knowledge that's generated to improve healthcare systems and practices. And the whole underlying tenet here is that it's about co-development and co-use. For those of you less familiar with what SPOR is, or the Strategy for Patient-Oriented Research, SPOR is an initiative that combines federal, provincial, and territorial partners, all dedicated to integrating research into healthcare. There are actually 5 elements of SPOR, and the support units are just one part of the 5 elements of SPOR. And there's 10 of them across the country. The BC Support Unit supports patient-oriented research really by looking at it through 2 lenses. On the blue circle there you see doing. this is how we support teams throughout the province that are undertaking research in healthcare that includes patients as partners throughout the continuum of their research project. We also, with the methods clusters, support the studying of the doing of patient-oriented research. So we have, that's the responsibility, the studying part of 6 different methods clusters. And as you can see here, patient engagement, Dr. Michalak is the lead for this cluster, but we also have leads in real-world clinical trials, data science and health informatics, knowledge translation and implementation science, health economics and simulation modeling, and our newest methods cluster that was just launched, patient-centered measurement. If you'd like more information about the activities and the projects and the more information about where each cluster is in its development, please go to the support unit website, and we have a specific web page for each of the clusters that you can find all that information at. If we had to think of, okay, well, what are methods clusters? What is their responsibility? What you see on the top part of this slide here is that there's 3 goals of the support unit in general. Those 3 goals are building capacity, increasing the quality of, and ensuring ongoing support for patient-oriented research throughout BC. So those are the overall 3 goals of the support unit. The methods cluster goals, their mandate is really to advance the evidence base for the methods, the scientific methods that are used within patient-oriented research. So it's really about advancing the science. It's promoting the use of the knowledge that is generated and promoting that particular field of research, whether it was patient engagement, patient-centered measurement, data science, etc., the previous methods clusters that we have been through. So how do we do this? Well, the methods clusters exist on a project basis. So together with our stakeholders, we help to identify where the strengths and the gaps are for each area of research, and then collectively identify some themes and some projects that could be undertaken to help to answer some of the questions that relate to methods, the ways that we undertake patient-oriented research. So the methods clusters are about studying the doing, but if you need help with the doing, then please go to our website and click on the green button that says Inquire About Our Services, and that will connect you with our regional centers and our other partners who can provide you with the kind of resources and directions to do patient-oriented research. So I'm going to pass controls back over to Erin here now to talk specifically about the patient engagement methods cluster and what's been accomplished so far.
Thank you, Alison. Lovely job. We're about a third of the way through what's been a very intensive, iterative process to make sure that we're really advancing some of the best science provincially that will have real impact in terms of patient engagement in research in our province. And you can see the major steps that we've gone through laid out in front of you there. The area that I wanted to get into a little bit more detail with you was around the process for stakeholder consultations that we've been through. More specifically on that, we have conducted a series of interviews. We performed an online survey before the visioning workshop, an expression of interest for attendance at that event. We held the BC Support Unit's first tweet chat, and then we conducted the visioning workshop, which we've been referring to. And I'm going to talk you through what we heard using each of those methods for stakeholder consultation a little bit at this point. So to look first of all at the interviews, those of you who are qualitative health researchers will know this is a fairly large sample size for qualitative methods. We conducted 32 one-on-one interviews, 2 group interviews, so a total sample of 38 people between November and January of last year and this year. The survey itself was conducted between December and January and had 62 responses, so it's a form of quantitative assessment. And the tweet chat, which was conducted on February 7th, had just under 40 active participants, something shy of 30,000 impressions. So that's the number of times a tweet appears on somebody's timeline, and about 500 engagements. Now, you may be wondering why we have chosen to use different types of methods for engagement and consultation, and it's because people dialogue and interact in different spaces differently, whether that's online, in one-on-one interviews. But one of the things we wanted to do was ask a series of core similar questions across these diverse consultation methods. And those included, what does real, authentic patient engagement and research look like to you when you see it happening? What are the core ingredients or elements of that? Where are we flourishing provincially, and where are we not flourishing so much? Where are the gaps that we can really make a difference with through the work of the support unit? And let me give you at least a high-level result of what we have heard and how it informed the visioning workshop and the work ahead of us. Now, you don't need to be good at math to know that the numbers here don't add up to 100%. This was the question we had on the survey where we asked people to identify their primary role, whether that was being a patient partner, a researcher, a healthcare provider, or a decision maker. We didn't force people to make a response on that survey, so naturally people selected more than one category, and that really speaks to the fact that many of us, if not most of us in this space, wear multiple hats. And identify as a researcher and a patient partner, for example. But you can see that we got some fair diversity in terms of the respondents on the survey, in terms of geographical location, just over half of them were from the Vancouver area and then distributed across the rest of the province. And these are some of the main messages that we heard from that survey, as represented by Erin Stewart-Elliott, our graphic facilitator. And many of these key messages are going to be familiar with those of you who are working in this arena. One of the key elements of patient engagement and research when it's working well is that it occurs across the spectrum of research and KT. So from the very inception of identifying the research question, the project or study that needs to be done, through to getting it funded, through to doing the research, through to publishing it, through to end of grant knowledge translation, and really sharing and disseminating those results as widely as possible. Patient engagement and research done well is something that really embraces and values diversity. This could be diversity in perspectives and lenses, diversity in ethnic identification, in age, in terms of where people come from geographically. One message that you'll hear us hitting on again and again during this webinar is the importance of embracing diversity in terms of getting to the next level of patient engagement and research in terms of opening the doors fully to people who face multiple barriers for engagement. Many of the people we've interviewed to date and spoken to have spoken to the idea of we're doing remarkably well in some areas in terms of engaging with white, middle-class, middle-aged women who are living in downtown Vancouver. That's not to say that there's anything wrong with white, middle-aged, middle-class women, but really in terms of the support unit, some of us here are definitely in that category. But in terms of what we can do in terms of really making an impact and advancing this area is really opening the doors widely to people from multiple walks of life and dismantling the multiple barriers that they face currently in that engagement. Part of this process, of course, as well, is about equity. It's about power sharing. It's about making resources available across the spectrum. Oops. It sounds like a bit of a truism in terms of valuing patient expertise, but it was seen as a core barometer for success in terms of creating a space where some of the power systems are dismantled and inequities that we currently have in the system to really allow full valuing of patient expertise to flourish. And over again, we heard that we need to fund and do science that has impact, that really makes a difference in the real world and the front lines of healthcare. In terms of strengths and where we're flourishing in British Columbia, there was a very strong theme around the timing is right. We have passion, we have momentum, we have people with their hearts and minds in the right place, and it's something that we can build on and will build on as an incredible asset to our work ahead. And then there was a very kind of ambivalent split response around this idea of infrastructure. There was strong messaging that we have had and do have wonderful platforms and legacy in BC in terms of multiple groups, such as Patient Voices Network, have really done fabulous work historically in this area, are continuing to be engaged, and give us a wonderful board to bounce off from through the work of the support unit. However, infrastructure in BC was also seen as something that we really needed to work on. One of the incredible things about our province is its geographical diversity. We have to think very, very carefully and strategically about how to support patient engagement and research in a way across the province of BC that is pragmatic, that makes sense, and really speaks to the unique things about this incredible place that we live. Where are the gaps? There are multiple gaps we're facing now and that we can plug through our work here collectively in terms of lack of evidence for patient engagement. This is something we're going to get to and touch on through the webinar today. But particular things that came through were in terms of gaps at the very beginning of the process of identifying what patient-engaged research to be funding, in terms of recruitment and methodological orientations and successful methods of recruitment across different types of projects. This was a very rich theme of data that we got, and what we're doing currently, Alison and I, is sitting with that data and really absorbing it to look at the real avenues and potential avenues for success in terms of different areas of science to fund and to move forward in terms of plugging these gaps in evidence that we're facing currently. Something else coming back to that previous issue we talked about embracing diversity is that although embracing diversity and patient engagement and research is a core value that many of us hold, it's not something that we're succeeding in currently. So rather than having this rich palette, this rich table of ingredients to hand currently and types of expertise and knowledge and ways of viewing the world, what we're actually experiencing at this stage was more often described as this. So instead of this rich palette, it was like, okay, well, you know, you can have hamburgers for dinner, and nope, they're not vegan, and they're not vegetarian, and maybe they weren't even ethically raised, but that's the lens that we're using or the ingredient that we're providing right now. There was probably one of the strongest themes through the consultations today was around the need to really advance science in terms of the diversity piece moving forward. Okay, moving quickly through the tweet chat results that we heard. This is a picture of a little bright-eyed and bushy-tailed before the tweet chat. We had fair representation across our different knowledge user groups and across the province, as you can see there laid out. We talked again through those same questions around how do you know when good patient engagement research is happening. One of the things I think that was really important for me from the tweet chat to hear, I think it's on the next slide, was this point raised by several people here by Katrina Hittman around this idea of intersectionality. Intersectionality in brief is this idea that there are interlocking, intersegue systems of power that really make an impact in terms of people's ability, particularly marginalized people's ability to engage, and how that much of the work that we need to be doing to advance patient engagement research needs to be done taking account and honoring an intersectional lens. And that was us after the tweet chat. We survived. And then Sterling O'Brien said, when will the next one be? We should arrange another one, I think, after this. And then moving swiftly forward to the actual visioning workshop itself, which was, I don't know, it was the highlight of my year so far. It was such a wonderful engaged day, held in downtown Vancouver. Nice large sample, 54 people in attendance in person in total. One of the things that was absolutely critical for us when we were designing this event was that we had equal representation across our stakeholder groups, and there were 15 people at the event who were identifying primarily as patient partners during that engagement stakeholder day. There was also good representation across the province, which was also important to us. And just to show you a little bit of how we spent that day in terms of the agenda, we spent much of the morning actually highlighting and talking about some of the incredible examples of engagement and research that are happening already. We asked our 7 presenters, many of whom were patient partners, some of whom were researchers, some of whom were both. We asked them all to describe in 10 minutes or so the projects that they were working on, but critically for the audience that collected today, to also describe on what their key learnings from that process were, so that we could really ground our conversations in the day on lessons learned, because those are valuable and critical for us to feed into this process. We are not reinventing the wheel with this work, right? And then we spent the afternoon talking about some of the big picture opportunities and possibilities for us for advancing research in this area, and then we spent the latter half of the day trying to refine those and winnow them down into some concrete possibilities for research ahead. And here are some of the meta messages that we heard from the day, and there are just a few things I wanted to pull out from the graphic recording for you. I really love Erin's graphic depiction, her visual depiction of the cycle of research at KT here, from a tiny germ of an idea through to something that's growing and being sustained and fed by its environment, flourishing, and then into something akin to a tree that's yielding its full harvest. If there are areas for real potential for us here within the support unit, it's in this piece here. It's in this piece here, and when there's that germ of the idea of research, we really need to work to figure out ways scientifically for people to get engaged in the priority identification part of the process in research. What research topics matter for patients? How can we open up avenues and conduits for them, for patients, patient representatives and partners, to really select and drive and advance what science we're funding, thank you, Sada, and how we're advancing that. So in that very early priority setting part of the process here. And then I also wanted to come back to some of the values and the ingredients that we heard reiterated through the day. These are going to be familiar to you because many of them are the stuff that we've talked about in this, just in this webinar. And they're important because they're the fabric of engagement and research done well. And I wanted to raise this again in that I think when we're working with researchers and patient partners through the support unit to select and advance science in this area, we're going to be looking for this fabric, for these elements, for these values to be emulated and embedded fully in the research that we're supporting. The research needs to share power. It has to have systems of very strong ethical principles in it. It needs to speak to diversity within the projects. And so we'll really be looking for the core values that have been not uniformly, but have come out across our stakeholder consultations as being very important across many of our partners and knowledge users. Okay, and then just to, before we go over to the Q&A section, just to speak to some of the candidate areas that we're working on currently. There are actually a few kind of in the hopper that are being worked on. They're not all ready for prime time at this point. As I said, we're very much still in the process of absorbing and really fully integrating all of the different information and knowledge that we've heard from these different methods. But it does seem that there will be there's real legs for a cross-cluster project. So this would be a project that would be developed between the patient engagement methods and clusters, the KT and implementation science, and the data cluster around this idea of citizen science. So you'll remember that we spoke to a couple of points in this webinar, the idea of being able to support patients to generate their own research questions, and then also this idea, which is really critical for maximizing the potential for use of data. citizen science projects potentially do just this. You would have been familiar perhaps with other projects that have happened internationally. Patients Like Me would be a very prime example that was established originally in the United States. The potential here would be to develop something like Patients Like Me, but with a very different set of values and that's specific to British Columbia. This would be a way for people to come together to share their data, with researchers, but also to drive science forward and interrogate that data in new ways, in a way that's empowering. And then no surprises here. We're really very, very interested in supporting and finding some legs for this idea for diversity, inclusion of more marginalized populations or people who have met or encountered multiple barriers to engagement or research historically. The way I'm thinking about this right now, and one of the things that really excites me about the potential for this area, is the idea that we could actually develop a project that has different pods or individual projects within it, which are working in specific marginalized or diverse communities. But wouldn't it be neat if we could actually develop a system for having some core metrics or outcomes that are similar across those different projects? So although the individual projects might be conducted in specific, very unique populations, if we could have some common metrics across those individual projects that would allow us to see the kind of meta-messages across those diverse orientations methodologically, that would really, I think, be very exciting. I think I might be at the end of my slides at this point, and ready to pass over to Alison just for the wrap-up.
I was going to just ask, Zara, would you mind opening up the phones now, unmuting everybody so that we have a chance to hear from people? As Erin has so eloquently shared here, we've heard a lot, in a lot of different ways, from people throughout the province. And we've shared what we've heard, but we didn't want to move ahead in moving specific projects forward without this webinar, to share this webinar to hear your thoughts about, in particular, those two preliminary ideas, the citizen science and the diversity, the potential for projects on diversity. We wanted to share those with you so that we can hear from you, whether you're joining us live now or whether you're reviewing this as a recording. Incidentally, our recordings from our other methods clusters, we've had like over 50 people view the one on data science. And it's been a very rich way to gain more information from people about their thoughts, to really round up the consultation with our stakeholders. So I'm going to be quiet now and invite you to share your thoughts. If you were present at the event, have we missed anything? Have we misrepresented anything? Have we misinterpreted anything? And if you weren't at the event, what are your thoughts about those two potential project themes or ideas? So I see Kimberly says, can you go back to the slide on citizen science? I'm going to see if we can go to that one. That one. Okay, Kimberly, I've gone back there. Those are the preliminary ideas for the project. The citizen science one, which is developing an online prototype that allows anyone, patients and public, to contribute their data, whether their data comes from self-reporting or from a wearable such as a Fitbit, etc., or automatically recorded health data, so people would opt into sharing this information. What we've found, as Erin has said from projects like this and Patients Like Me, is when you get such a large source of data, you see questions that you couldn't otherwise identify if only 10 people were involved. It helps to identify some questions.
And for, now of course, when we're talking about a BC system like this, it wouldn't have the capacity or size of something like Patients Like Me, but it does allow you to ask questions about those rarer types of conditions and disorders or diseases as well. So if we were looking at the lived experience of patients with a condition that just has a few hundred people experiencing it in British Columbia, with this kind of a system, it would allow us to connect those people so that they could share experiences and actually think about potentially, for example, the research questions that matter to them. The other important thing to mention from this is this piece around the qualitative data as well. I think this speaks to a larger message we've heard around mixed methods, about the importance of really thinking carefully about how we can blend qualitative, i.e. interview or story-based research, as well as quantitative research, which is more numerical in nature, and how we can take advantage of those two things in a real kind of symbiotic manner.
So I see that Leslie has raised her hand for a question. Leslie, just before you ask your question, I just wanted to add to Erin's point there about the patient stories as a different form, that the data science methods clusters, there are technologies available that help to analyze words, and so that's the component that the data science can add to it. So Leslie, please ask your question.
Oh, I have a cold, and sorry, so I'm sounding funny. Along the citizen science piece, I'm just thinking loud with y'all. We had Steph Chia come and do a session with the Tanaha Nation elders around the Health Connections project. And this was one of the things that they sort of went to around like the ability to suggest research or to have so I like this idea of an online forum, and I'm just wondering if it could be a part of maybe that project, like so tie the citizen science idea with that project that's already being created.
So I would encourage you, Leslie, that's great. Thank you for sharing that idea. And as much as possible, we would like to link and leverage existing projects. I would encourage you maybe to follow up with an email with some bullet points giving us some specifics on it so that we can reach out to you for some more detail. I noticed that there's a question from Ingrid and then a question from Emily. Can we hear from Ingrid first, please?
This one as well. So the question here is around really empowering participation for people who aren't online through these projects like citizen science. And it's a really excellent question, because I think one of the things we do a disservice to is thinking about the digital divide in people. So that is not just thinking blankly about whether people even have access to the internet, which is going to be an issue for some, but even for those, it's reported that whatever, 80%, 90% of people in BC have access to smartphones or online. There are issues beyond that, right, in terms of what is their digital literacy? Do they know how to use a webcam? Are they empowered in a way to engage online, even if they can get online with other people in a very equitable manner? And so I think it's a beautiful example of how we could advance the science in this area in terms of thinking about how can we do consultation in more rural or remote or less online areas in British Columbia, and that might be through face-to-face consultations where we're also building community at the same time, perhaps even building digital literacy at the same time. And it could be through libraries, for example, in a way where you're building capacity in the system. So it's a really very thoughtful question, and I appreciate that in terms of thinking about how can we also address the equity issue still through projects that are IT projects primarily, but may still have capacity for addressing problems in IT access that we have provincially.
So Ingrid, thank you for that question, and Erin for addressing that. Before we go to the questions that, or the points that, comments that Kimberly has shared, can we go to Emily, who had raised her hand?
Hi there. Thank you for the overview of the work that's been done so far. It's really exciting to see all the engagement that's already been happening, and I'm sorry that I've missed out on it so far, but excited to be coming on board at this point. Really excited about the preliminary ideas for projects that you've posed. And similar to Leslie, wanting to echo any opportunities that there might be to build on existing work that's happening, because I think many of us are probably engaged in some work that would have relevance and that we could be really smart in how we're using additional funds to piggyback on some of this work and ensure that it happens to the best of our abilities and capacities. Some of the learnings that we've had in the work that we do with youth, where we're trying to ensure that there's meaningful engagement of youth in research and in policy spheres, is around the flexibility that's needed and the many factors that shape people's ability to be engaged, whether those happen kind of at an individual level or a social or structural level. And so needing to be really flexible in how we look at engagement and how we make decisions about who becomes partnered in the research that we're doing. Another piece is around the funding, and I noticed that in your presentation so far as being something that's important to consider, and indeed an area that we struggle with in terms of making sure that there's appropriate compensation for people to be involved. So just, wondering as these projects get underway if that's a consideration that can be at the forefront again. A piece that we were struggling with in terms of working with populations that experience significant forms of marginalization or vulnerabilities is around their abilities to identify how they feel they can meaningfully be involved if they haven't had an experience like that in the past. And so one of the things that we've been considering moving forward is the identification of what we're terming right now more activated individuals who would be peers, but who have had these types of experiences, who could provide mentorship, who can demonstrate what's possible because of the work that they're already doing, and bringing those people on board to be central figures in that process and to help with the capacity building process. And the final one that we're working on right now and really struggling with and needing to consider further engaging in this from a research perspective is how we build capacity or do training with our partners so that they can be meaningfully involved and so that they gain the skills to contribute in a way that results in something that's of value to them and of value more broadly. So excited to work hopefully together in some capacity on moving some of these questions forward. I think the metrics and the outcomes piece is so important so that we have some data to work with moving forward and can continue to refine and create better approaches to this work. So yeah, so if there's opportunities to link in to some of the pieces that I'm working on with groups or other people are working on, I think a great use of resources.
There's so much I enjoyed about what you just said, Emily. It's really important for you and other people who are viewing this webinar now or afterwards know that if this is your first exposure to what we're doing, you certainly haven't missed the boat. This is the prime reason that we're doing these webinars, and we're still very much in the process of identifying, the real kind of thought leaders provincially in this area and bringing you guys together in a way that will empower you to do things that we can't do currently. And I think that also speaks to the point you were just making about really kind of honoring our capacity to get traction on projects that are already, really have their feet very firmly embedded and have made good progress in various areas, but where through the support unit and through this method cluster, we can just support groups to get to the next level in a way and through partnerships perhaps they couldn't beforehand. There are so many responses that we would like to share with you. I don't know if we have the time for you, but afterwards I think we would also like to send you some details about the compensation piece. We have some guidelines that we've developed that have been worked very hard on. This is core to doing patient engagement well, is really respecting and honoring people's contributions in a way that makes sense for them. And we've been working very hard as a group to develop a very diverse array of guidelines to share and to work with through the support unit in this precise area.
Excellent. Thank you. And Emily, from these answers, from your comments and from these answers, if you want to continue the discussion, and actually everybody who's participating now, and if you are viewing this recording at a later date, we are keeping a distribution list to be able to share information. So please contact us at the support unit, and we'd love to add your email addresses to that distribution list so that you can keep in contact with what's happening for this and other clusters. Kimberly, I see that you have a couple of comments here. Would you like to speak to them?
Sure. There we go. I'm Kimberly. I'm a patient partner based in Abbotsford. And let me see what I was saying here. Oh, yes. I was just looking at the citizen science thing with regards to the self-reported data. And the thing that comes to my mind, and especially when we're considering diversity and social determinants of health, is if having self-reported data affiliated with certain devices like Fitbits or whatever it is, are we kind of creating something that's only catering to those who actually have access to those tech devices? And I guess my second point was I came across a digital engagement platform called Voice Global, and I'm not sure if you've seen it, but it might be something to check out if you're looking for other examples as to how this type of work can be done digitally.
I hadn't heard of Voice Global, so thanks so much for that tip, and thanks for the issue that you raised around not creating even greater barriers through tech, wearables, and thinking about supporting inclusion through that. There are lots of different models that have been shown to work internationally. Some of those, for example, would include partnership with IT companies, partnership with industry, the provision of devices for people to use. In some studies in the global health arena has actually shown that it's money well spent in terms of giving people access to health information, looking at the economics, the health economics of that down the line. You can, through some research, it's shown it makes very, very good fiscal sense to provide access to people through wearables, for example, to new types of health information and recording. But a point very well taken around thinking about financial inclusion and not creating barriers through the very work that we're doing and being acutely aware of that.
Thank you, Kimberly. Did anybody else want to ask any questions? You can either type in the chat box or feel free to speak up, or press the hand there to raise your hand, and then we know that there's a question in queue.
Hi, I would like to thank you for excellent pulling this all together job. Can't imagine the speed you did this with. So wonderful, and it resonates what I've heard so far as Karen speaking from Nelson Interior. Just remind me, what are sort of next steps that you envision as the unit? Because I missed that part, sorry.
Sorry, next steps in terms of what, Karen?
So what's happening now after we had you pulled the data and the projects and I think you alluded to it at the meeting that we had in Vancouver. You identified ideas for projects.
Yeah.
What is the next step?
Karen, thank you. Yeah, I couldn't have asked for better timing on that question because that was the very next slide. So much appreciated. And for those that are listening in, I did not plant that question with Karen. From all the different consultations, the plethora of consultations that we've undertaken, our next steps, including the feedback from today, and it doesn't just finish when this webinar finishes, please feel free to contact me. The next slide has my email address. So we will then summarize the themes and the potential project ideas. So if there are people either listening now or looking at the recording, or please speak with your colleagues. If you have potential project ideas, then please send us that information, and we will set up another time to discuss those further with you. So as you can see, we have we've only shared 2 of them right now because there's more work that needs to be done. So that was done. Then there's today's webinar. We will then create a report on what we've heard and send it out via that distribution list and through our newsletter. So please pay attention to the Methods Cluster corner of the BC Support Unit newsletter, where we will ask people, have we heard this right? Have we got this right? Do these projects, do they resonate? We continue to invite your input that way. Once those have been identified, and obviously we're looking for projects that not only speak to the themes that we've heard, but also geographical distribution, also leverage expertise throughout the province, give opportunities for trainees, unite existing projects. There's a lot of different criteria that have to be factored into the consideration of which projects could potentially move forward. Once those have been identified, we'll be, again, reaching out to everybody saying, please put up your hand. Would you like to lead this project? Would you like to collaborate with this project? Or would you like to be kept informed of what's happening with this project? Once the teams have been identified, we have a template for a project proposal. So we'd work with the teams to help to complete this 3- to 4-page project proposal. That project proposal then comes to all of the leads of all of the methods clusters. They meet regularly once a month in a science council. Those ideas, those projects would then be shared. And then the next step, to add another level of not just rigor, but also richness, is we send those proposals that are woven together into a work plan for the cluster to external reviewers, reviewers outside the province, who can then give us ideas about how to potentially strengthen that project. Once then those project proposals and work plan have gone through external review, then we can move forward in funding those projects and launching them. So that's kind of the scenario. If you're actually interested in a little bit more detail about it, so Carmen, we kind of anticipated that this might be the question. Sterling and I undertook a webinar on December 13th where we walk through the different steps in the development of the methods clusters, identifying the projects, and then how the projects are moved forward. So this link is on our website under resources for the support unit, and you can listen to that 1-hour webinar that gives, I've just given you a high-level overview, but there's more details in that webinar. Just looking at the time, are there any further questions? Yep. So here's our email addresses. Feel free to, I try and collate information when it's coming in from many different sources so that Erin doesn't have to deal with 25, 30, 40 different emails. So although her email address is there, please feel free if you wish to send it to me first, and then I can package it all together into one single long document for Erin rather than separate emails. And so because we'll just give one more opportunity for questions. So hearing none, even if it wasn't possible for you to ask them now, please do send them by email or feel free to call me. My contact details are also on the website. Thank you all again for your time today, and we look forward. This is very exciting, and it only gets more exciting as we move along. So thank you all.
Thank you.